This is the ultimate documentary when it comes to the subject of hair.
I think this guy has the ultimate hairline. I'm a double board certified hair transplant surgeon, and today I'll be reacting to this video by BeerBiceps that's called the Ultimate Hair Care and Hair Transplant Documentary.
Hair care, the need for transplants, and the mental health aspect of hair loss. These are the three subjects covered in today's documentary. Hair loss isn't rare anymore. 85% of men experience hair loss.
I don't think hair loss was ever rare. I mean, we're definitely more attuned to it now. We see it all over social media. People are talking about it more, but it doesn't seem to me like the incidence has increased over time. It's a very kind of common, normal thing that happens for most guys, is that they lose some hair to varying degrees as they get older. And there are, of course, less common forms of hair loss, the most common being androgenetic alopecia, but there are more rare forms. Like my version, for example, is alopecia areata, which is an autoimmune type of hair loss. So remember, there's different forms of hair loss. But from what I've seen in the literature, I don't believe that the incidence of androgenetic hair loss is necessarily rising.
This is the ultimate documentary when it comes to the subject of hair.
I think this guy has the ultimate hairline.
Men all over the world are trying to make their own confidence levels shoot up by dealing with this receding hairline problem first.
We're all trying to feel a bit more confident, right? And that's true the world over. Men, women, from everywhere.
Minoxidil is higher in demand than ever.
So what is Minoxidil? It's basically a topical solution that you apply to your scalp.
It also is available as a pill. We've talked about that extensively on this channel. In the United States, it's FDA approved as a topical formulation for hair. But in terms of how it's available for consumption, pill form is very much available. I know that in some countries it's hard to get the pill version of Minoxidil, but it's generally a more potent form of it and can have more impressive results, but also carries some more side effects. And we have a video on oral Minoxidil that talks about all of this if you want to learn more about it.
It helps stimulate the hair growth by increasing the blood flow to your hair follicles. Follicles are tiny pockets located just beneath your skin.
It's blood flow, but it's also the increase of the anagen phase of the hair growth cycle that leads to a thickening of one's hair.
They supply the hair with nutrients and are essential for healthy hair growth. Topical Minoxidil is one of the most commonly used FDA-approved treatments for early hair loss. It improves blood circulation and prolongs the hair growth phase. For those who can't tolerate the topical form, low-dose oral Minoxidil is a great alternative.
It's not just for those who can't tolerate topical form, it's also just stronger. So there's plenty of people where they don't really see a lot of gains from the topical, but when they switch over to pill form, it's much more impressive in terms of the overall thickening of one's hair. Remember that Minoxidil is not truly getting at the root cause of hair loss. So eventually it's still like a losing battle because the hair will still generally fall out if it's already genetically programmed to do so, but you're kind of stalling that process a little bit with Minoxidil. But it can be deceptive in that you're on something hoping that it's going to prevent further hair loss, but it's not really what it's intended for. I'm sure they're going to get into finasteride or Propecia, but that is more of the preventative medication. Minoxidil just provides some additional thickness that can look quite impressive, actually. It's just that if you're taking it hoping that it's going to give you ultimate prevention, you might be disappointed.
That also helps reduce hair fall and boost density, but it should always be taken under a medical supervision.
It's not necessarily for boosting density, it's for increasing the caliber of the hair. So it's taking the hair from a more villous type of configuration into a more terminal state where it's a thicker, more robust hair. And when you multiply that out by thousands on the scalp, it can be quite impressive in terms of its ultimate outcome. But it's not truly boosting significant density in the sense of new hairs. It's really taking the existing hairs and making them thicker.
According to a 2025 market report, Minoxidil sales have jumped in the last couple of years, especially through online platforms. But if you speak to most qualified dermatologists, they'll tell you that Minoxidil is simply a temporary solution for this problem of receding hairlines. Most men.
John Cena, by the way, has been very open about his crown hair loss and his hair transplant for the crown. I released a video on John Cena right before he was public about his actual surgery and before we started to see some of the results of that procedure. So if you want to take a look at, again, my video on John Cena before all of this latest information on his actual hair transplant, make sure to watch that video.
Who dealing with receding hairlines eventually, when they can afford it, opt for a hair transplant.
We also have a video on Akon and on Elon Musk. But Akon, in at least the past year, has somehow reversed some of the results of his transplant. So I'm not sure what's going on there, but that might be a subject for another video.
Hair, that's the theme for today's video. That's the problem we're trying to sort out in today's video. We had hosted Dr. Abhi on the show some time ago. Thought I'll actually go visit his clinic. I'll actually sit while he's going about a hair transplant, interact with the patients.
See, it's tricky because it's hard to know if like the clinics or that doctor is paying this group for promotion to talk about their practice. I mean, sometimes doctors do that, and other times it's purely organic in the sense that they just pick this one doctor and paid him a visit. But it's hard to sometimes tease out how promotional these documentaries or any type of online coverage is, which again makes it more difficult for the consumer to figure out, is this a place I can trust? Because ultimately that's what it's about. When you're picking a hair transplant clinic, it's like, well, can I trust this doctor? Can I trust this clinic to take good care of me, to give me good, safe care, and to deliver a great outcome? That's what everyone's asking themselves when they're trying to find where to go for hair restoration or any other type of medical procedure for that matter.
How are you guys feeling?
All good.
Thank you for having us here. Mainly, this video is for men all over the world. It's not just an Indian problem.
Definitely not just an Indian problem, but also not just a male problem. Women also lose hair significantly over the course of their life, and that can start very early. And hair restoration surgery is also available for women, and as well as like other forms of hair restoration that are non-surgical. So I think that's really an important point, and something that isn't really talked about enough for some reason. Plenty of women deal with hair loss, and somehow, we just don't really think about it as often as we think of men getting, this type of hair work done. But I had a podcast that I did with a really interesting woman who goes by the name of Y. So if you haven't seen that podcast about women's hair loss, make sure to check it out.
It's a global problem.
Early days, we were seeing this kind of problem seen in people who are 30s, 40s, late 40s, 50s. Now we see a lot of patients in early 20s also having this problem, going bald. Frontal is receding, crown is receding, and everything is because of the aggravated lifestyle modifications that we see.
Yeah, I don't know. I still don't think that the incidence is rising. I think we're just more attuned to the hair loss. And I think that guys in their 20s historically didn't have as much access to hair restoration options. I mean, it was always, a bit more pricey, and guys in their 20s classically are, starting to finish school and build up their careers. And maybe it's not top of mind, no pun intended, their hair loss and how to address it. But then when they hit their 30s, they have, a little bit more saved up. They're able to, maybe find time for this type of process. But also nowadays, it's much more accessible. It's out there. You can just pick a place, pick a price, and fly somewhere, right? And get the work done. And so I think that's what's changed more than younger guys all of a sudden starting to lose their hair more frequently.
Medical tourism to Turkey has increased because it's become the hair transplant capital of the world. Until now, according to the Towards Healthcare research paper published in May 2025, India saw over 3 lakh hair transplants in 2024 alone. That's one hair transplant every 2 minutes.
I'm not sure why we're competing on just frequency. In my mind, at least, it's not just about how much of something is being generated. It's like the quality of that thing that's more important. And at least that's more important to the patients who come see me in my clinic. But I get it. Some people will equate, just overall frequency and numbers as like being better. But again, just take the example in the food industry of something like a McDonald's. I mean, how many chicken fingers do they make, or how many hamburgers are they flipping and serving every minute, let's say, all around the world? I mean, too many to count. Does that mean that they have the best chicken nuggets and the best hamburgers quality-wise that money can buy, or that that tastes the best? I think most people would argue no, and yet they are everywhere, right? So just keep that in mind as people get so enamored by numbers and drawn to numbers. But at the end of the day, these are human beings getting surgical procedures, and these are aesthetic procedures. These are works of art. So you can't just go any random place and expect to get something great, right? You have to do your research and pick a trustworthy place that has a good aesthetic eye for this stuff.
A lot of people go to Turkey for hair transplants because of the hype and medical tourism. But what they don't realize is that in many centers, the procedure is performed, often done by technicians, in a single long day. Safety and results can be compromised in the process. In India, especially in reputed clinics, doctors perform the entire procedure themselves with full skill, multiple sessions, and zero shortcuts.
All right, first of all hair transplants require a team. There is no place in the world where, a good place, I should say, where there's just like a doctor doing everything. There are places that promote themselves as, the doctor is the only person to touch the scalp. And, that's fine. That's all well and good as long as they're getting excellent results. But even those doctors will have technicians loading grafts into implanter pens, for example, or analyzing grafts or trimming grafts under the microscope. Those are real team members. It's not a one-man show or one-woman show. It's a team effort. The doctor needs to pick the right team members, but it's a team effort. And then, of course, you have the other end of the extreme where the doctor is literally not even around. They may be in the building, they may not be in the building, and you have technicians who are not really licensed to do all the parts that they're doing. And so you have the full spectrum. But just because your doctor is involved doesn't guarantee you an excellent outcome or the safest outcome. But of course, that should be there as a minimum, that your doctor is around to at least design your recipient area, to ideally create all the incisions, to do, if they don't have someone who's licensed or of the caliber who can extract safely and legally, then they need to do that part. There's all types of considerations, but people just trying to scare folks out of going to places that have technicians helping with parts of the surgery is also not necessarily the most fruitful activity. But I think it's a complex subject, and it's something that is a very touchy subject for lots of places. And it's not just a Turkey thing or an India thing or a US thing. I mean, there's plenty of places in the United States where the technicians do the whole surgery, or where the doctor might be, in the room next door, but they don't even know much about hair transplant surgery. They just offer it as an additional service in their clinic, right? So it's tough. It's tough for, again, consumers and patients when they're trying to figure out, where should they go for this surgery? Who should they trust? How do they know? And I think more doctors being out there educating their patients, sharing their real results so that, patients can review galleries and decide for themselves if they like the work that they're seeing, good standardized photography. I think all that is super important. We need more of that. But yeah, just some thoughts.
There is no over-commercialization. The approach is personalized, safer, and more ethical.
Again, he cannot speak for all of India. It's a massive country, and saying that everyone is doing ethical work and much better than Turkey, I think is ridiculous in my humble opinion. Same thing with me saying that, in America, we do the best work out there. No, it's it just depends on the doctor and their skill and their team. So, even in New York City, there's a whole range of different skill sets and abilities, and people just have to pick wisely, pick within, their budget, but ideally pick a place that, you like their work, you like what they've generated, and where, of course, the doctor is involved in the surgery. So again, I don't like this kind of my country is better than your country approach. I don't think that that's leading us down, a good road. I think just overall, worldwide, we need to improve, raise the bar, not just for safety and efficacy of the surgery, of hair transplant surgery, but also the actual aesthetic outcome. I think oftentimes the artistry is not discussed enough, and that's important in a surgery that's meant to be an aesthetic surgery.
And also the results match up to the global standards.
Say 70% of our patients now, we have our overseas patients. They are flying from the US, UK, all of that.
If you had to get a hair transplant in India, how much would it be roughly?
Cost is very subjective here at Assure. We have different segments of doctors. If I talk about in terms of Indian rupees, so it would range between 2 lakhs to 15 lakhs based on the complexity as well as the surgeon's seniority who's doing it.
If you're in a tough spot where you're unsure, if you're anxious, if you're just tired of feeling judged by the society around you, take a breath and listen to what the older guys, the experienced ones have to say. They've been through it too, and they're here to help you. We help each other. That's how human society should be built.
Hard to argue with that.
I started losing my hair in my late 20s. I'm 46 today.
You know, there's like a lot of younger guys especially dealing with like hair loss related problems.
Yeah, it's more challenging for them, especially if you're looking for a life partner. So you have to work harder on your confidence because you know that you have to compensate that this is missing.
Again, going back to feeling more confident, I think at the root of all of this, it's why people get any type of aesthetic procedure, whether it be surgery, whether it's just, honestly applying makeup or getting Botox, filler. I mean, there's just different gradations and, levels or extremes, if you will, of this stuff. But it really comes down to all of us feeling more confident. That's why, I named my skincare and hair care brand, Feel Confident. That was the impetus for that. But yeah, we all want to feel more confident. I mean, I think that's so huge. And I know personally, that's how it was for me. Like when I lost all my hair from alopecia areata, the autoimmune type of hair loss, like it was terrible, and took me some time to kind of gain back some of that confidence. So yeah, I think it's interesting to think about.
What did you learn on a life level from this whole process?
Don't start blankly using products just by looking at it or somebody's showing an ad on Insta or something. Don't do that. Do good research. Take multiple opinions from doctors.
Can we talk about the hair transplant also?
Yeah, of course.
The first time you did, you said you got it done in Chandigarh some time ago.
Yeah, 8 years ago.
Yeah, I think people need to understand where medical therapy fits into hair restoration and not just jump to surgery. Oftentimes people reach out to us and they're looking for surgery. They ask, when can I book the surgery? But we say, let's take a step back. I mean, is your hair stable? What are your goals? Do you have enough donor supply for what you want to do with your hair? And a lot of times I feel like they, are still losing a lot of hair and it's not exactly the right time to do surgery. And sometimes I'll tell people no, like now is not a good time. And many patients will get upset, because they want to jump in and do surgery. But being told no is sometimes the best thing that you can hear. And a lot of people won't tell you no. They'll just take your money and do whatever you ask them to do. So, there's just a lot to it. But when you're in need of some assistance with like hair restoration and you seek out a doctor's help, really listen and really don't allow them to necessarily push surgery on you if there's something else that's, needed. So, again, you got to go to someone trustworthy who can give you the proper guidance.
Firstly, let's talk about something basic but super important. Hair care. While I've covered some very common mistakes, there's a bunch of tiny hair guidelines that we've covered in our past videos. I'm just going to list some of these guidelines around me in this particular frame so that you can pause the video, take a screenshot and get a lowdown on habits for healthy hair. Are you ready? In 3, 2, 1.
Oh my God. There's a lot of information here. So let's take a look at this. So do's, oil hair in moderation. Yeah, if the hair is too dry, then you might need some additional oil. If you have oily hair, you oil it less. You kind of give it what it doesn't have. Apply herbal masks. I don't think there's a ton of data to support that, but if you apply them in moderation, then it should be fine. Pick gentle shampoos and see which suits your hair. Yeah, of course. It's not like there's one shampoo that's going to be right for everyone. What we tried to do with our Feel Confident shampoo is to try to put in like DHT blockers that are natural occurring DHT blockers like saw palmetto, pumpkin seed oil, and also some additional components that can help boost the hair to a degree. So that's stuff like curcumin, caffeine. So we tried to really narrow it down to the essentials, and we call that the root defense approach. He says here, wash with lukewarm water, never very hot. Well, yeah, you don't want to be injuring your skin, really. I mean, so applying very hot water can potentially hurt your scalp, which is not a good thing. Do detangle slowly with a wide tooth comb. Okay, yeah, depending on your hair type, but a wide tooth comb can help. Do eat protein and leafy vegetables. Yeah, I think that's just good general advice for everybody. Do drink plenty of water. Again, good general advice. Cover your hair in the sun or the dust. Yeah, especially in the sun. And again, that's primarily for the scalp care, right? You don't want to get sunburn on your scalp. Skin cancers are possible on the scalp. So, all that's important. Do trim every 6 to 8 weeks to stop split ends. Okay, fine. Do keep scalp clean and fresh. All right, yeah. Clean and fresh is always good. And do visit a dermatologist when problems persist. Well, yeah, I mean, if you have scalp issues like severe dermatitis or some other activity on the scalp that you're not sure about, you definitely want to see a specialist for that. Don't do daily shampooing. So yeah, there's always this question of like, how often should you shampoo? The answer again is not going to be the same for everybody. So if you have very oily hair and scalp, for example, it's actually recommended to shampoo more frequently. If you have drier hair and less oily scalp, then you want to shampoo less frequently. So it just depends. But you don't want all those oils building up. They can clog pores and give you other issues and potentially promote some degree of hair loss. So that's an important point there. Avoid shampoos with sulfates or parabens. Yes, harsh sulfates can be drying and quite damaging to the hair. And that's why for our Feel Confident shampoo, we left out all harsh sulfates and parabens, of course, as well. Don't avoid tight hairstyles that pull roots. Okay, so this is an error. He meant to say do avoid tight hairstyles. So this should be on the do side, not the don't side, because tight hairstyles can pull at the roots, and as they do that, it causes increased inflammation and can result in various forms of scarring alopecias. Don't limit chemical treatments. So again, I'm not sure why this is in the don't column. This should be in the do column. You do want to limit chemical treatments. So that's odd here. Don't minimize dryers and straighteners. No, you do want to minimize drying and straightening, because if you overdo that, it can harm the hair. So I think something with these columns is a little off. Don't never sleep on wet hair. You don't really want to sleep on wet hair, so probably again in the do column. Don't manage stress to cut hair fall. No. Do manage stress. So I think they just made some errors here with like which column it belonged to, but in general, this is good advice that you want to manage your stress levels, right? That makes sense. And surely stress can potentially poorly affect our hair. Don't over oil or leave oil on overnight. Again, you don't want to over oil, and you don't want to leave oil on for overnight that is in excess, right? And again, for every hair type, it's going to be different. And then again, forgetting about the column that it's in, but yes, avoid chemical heavy serums and sticky styling gels. Of course, that will be potentially harmful for your hair, and avoid heavy waxes and hairsprays. Yeah, so again, great general advice. I think the do's and the don'ts columns don't necessarily apply here very accurately, but good general advice here for sure.
And now we're moving on. Always imagine that your hair is like a tree. The scalp is the soil. And just like a tree, if your roots are weak, the rest will eventually weaken.
Dandruff is one of the most common hair health concerns among men worldwide. It is often the first red flag when it comes to early signs of balding.
There's some loose correlation between dandruff and hair loss, but again, it's not the strongest correlation. So a lot of people have dandruff and don't have any significant hair loss, and a lot of people who have significant hair loss have no dandruff. So it can contribute, but typically that's not the primary contributor to androgenetic hair loss. So yes, it's nice to address the dandruff, but it's again not the main thing. So if you just focus on the dandruff and you're not on medications that would help prevent further hair loss, you can find yourself in a less than ideal situation as far as your overall hair.
Over time, dandruff can clog the pores on your scalp, cause persistent itching, and weaken your hair at the root. So the first step to fix the foundation, if you're dealing with dandruff, always use a good quality anti-dandruff shampoo.
And this is something that we don't recommend people do daily, but usually like twice a week is a pretty good frequency for something like a ketoconazole shampoo that has some antifungal properties that seems to help with seborrheic dermatitis, or otherwise known as dandruff.
As per a 2018 study, anti-dandruff shampoos, whether they contain traditional antifungal agents like selenium sulfide or zinc pyridone, or natural compounds like DPG, have proven to be effective in managing dandruff and improving the scalp health.
Ketoconazole is another popular compound that's used for dandruff.
So if you're dealing with this problem, firstly, tackle dandruff. Secondly, for the dandruff problem, keep your pillowcases, your helmets, and your caps and hats clean. That's where the bacteria exists.
It's bacteria, but it's also yeast. Yeast is a big part. So fungal elements is a big part of that condition.
Next, try avoiding scratching your scalp because that's going to do more damage in the long term. And now if you're someone who uses hair products often, here's a quick breakdown of how they actually may be messing around with your hair just a little bit. Hair serums, they make your hair look shiny, but most are packed with silicones. Overuse may lead to clogging, especially if it trickles down to the surface of your scalp. So if you want to use hair serums, make sure you're only applying it on the body of your hair and not the scalp.
Many scalp serums are actually intended for the scalp skin health and not just to be applied on the hair shaft, which is what he's getting at. So definitely, depending on how it's made and the consistency of the scalp serum, it can sometimes be safer or less safe to apply to the actual scalp. But for example, our scalp serum that will be debuting later this year is really meant as a leave-on product. So it's meant to stay on the actual skin, not just on the actual shaft, because we do want to get to the actual root of the hair, and it's going to be less likely to do that if you just apply it to the actual tip of the hair shaft, as opposed to closer to the base of the shaft or onto the actual skin.
Next, hair masks, they definitely help in moisturizing your hair, but they don't fix hair fall. Same rule, if it trickles down to your scalp, it's going to cause a problem.
That's not true. I mean, eventually it gets washed out. Just because it hits the scalp does not mean it's going to cause a problem.
Next, gels and wax. Fantastic for styling. I end up using gel and wax pretty often.
We can tell. It looks good though.
But you need to take a lot of care of your hair. If you're dealing with these products, you need to ensure it doesn't touch your scalp. You need to wash it off. You need to remember that these products dry out your hair. They do speed up breakage if you're already dealing with some kind of hair loss. So style smart, but also take care of the trees on your head. Blow drying, again, you're adding a lot of heat to your hair. If you're regularly blow drying your hair, even on low settings, it breaks down the protein in your hair, takes away the moisture, and especially if you skip heat protection, eventually this will lead to split ends, dryness, faster breakage.
Yes, but again, there's two different things. There's like the general hair care for the shafts of hair, right? And that's kind of what he's getting at here. And then there's like hair care for the actual root, right? And that's kind of what our Feel Confident products get at. And that is what I think he's kind of also getting at in certain other parts of this video. But there's sort of differences in what you want to do for the root versus for the actual shaft. And of course, general kind of precautions for hair care like he's mentioning here are, good to keep in mind.
I myself have always recommended that you oil your hair regularly. Of course, if that oil is left on your hair for very long, it will cause damage to your scalp. It will trickle down to the surface and may clog your scalp. I've asked multiple qualified dermats the same question, and I've always found that people are divided on this process of oiling one's hair. I do believe that it's extremely subjective. What works like magic for someone may harm someone else, but the truth is that enough scientific research has not been done on this process of oiling one's hair.
If someone is already experiencing hair thinning or baldness, oil cannot reverse that or help with new growth or density. The main role of oil is to provide a bit of moisture on the scalp. Medically and scientifically, oil doesn't play any active role in treating hair loss. But yes, in Indian tradition, oiling has always been a part of the routine, more as a cultural habit than a treatment.
Yeah, I mean, beyond India, oiling is still something that's done. And if you have drier hair, like he said, adding an oil can provide some moisture, but it's not necessarily, going to change radically the overall course of your hair loss. So I agree with him.
Is there any way to grow your hair longer, faster?
See, again, a lot depends on the genetics, right? A lot of people naturally have very fast hair cycle where it grows really long. Some people struggle to and they don't. Good nutrition definitely overall helps the hair health, but again, there's no magic for the hair to grow longer otherwise.
When you say good nutrition, you're referencing good protein intake, good hydration?
Yeah, everything, a balanced diet, right? And obviously, a lot of people nowadays you see have deficiencies, like there's a D3, B12 deficiency, iron deficiency in women is so common. So all of that, obviously regular blood work and getting those deficiencies corrected is important.
Can you also just give me 2 or 3 like superfoods that you can eat for healthier hair?
So nuts, something which everybody can start their day with, almonds, walnuts, chia seeds, all of that. Avocado, nowadays people want to add in their meat.
I love me some guacamole, so maybe a little guacamole, and there's gonna be a lot more hair on this head. Tired of wearing that hat. Let's drop that.
So that can be done. But high intake of protein, of course, like paneer.
That's delicious too. Oh my God.
For vegetarians especially. Tofu, all of that is great.
When it comes to the process of hair loss, you may be doing everything right and you still find that you're losing hair. Why? Because most of the time, as is the case in 2025, our genetics kick in. In some cases, it's not just the genetics, it's lifestyle factors as well. All of this leads to something called inflammation. Inflammation is related to the heat within your body. Body is basically in fight mode most of the time. Constant stress, toxic food, poor habits. They're all triggers for your immune system to go into a defensive mode. Now, when your body is truly inflamed, your scalp isn't getting the kind of blood flow that it needs. It's not getting the kind of oxygen that it needs. And that messes with hair growth. In most cases, excess internal heat in the body, according to Ayurveda and even modern nutrition, is down to lifestyle factors or diet. Now, this excess heat in the body usually shows up on your face and your scalp. Acne, dry skin, rashes, or hair loss.
I don't know about this excess heat theory. Haven't seen anything in the literature, supporting this exactly. But inflammation, sure, but inflammation can come in different forms. And one form of it is your body attacking itself, right? So that's more of the type that I have. And that's usually, something triggers it, like say a virus that we get, and then the body's trying to fight off the virus, and it creates certain proteins that are fighting the virus, but also might look very similar to something that then can attack your own body cells. So in the case of alopecia areata, it's the actual hair follicles that it's attacking, and can be a bit of an unpredictable type of condition, and that's what I have. But I don't know about the heat generated. I don't know about that. Maybe that's more from the Ayurvedic medicine that he mentioned, but at least in kind of our modern medical system, we don't really think of that excess heat as being the main problem. But again, it's an interesting theory.
What's the long-term game plan in order to reduce the rate of hair fall? Basically, keep your body healthy and your hair will also stay as healthy as is possible according to your genetics. So as far as possible, fix what's inside and it'll reflect on the outside.
Balding doesn't occur overnight. It progresses in stages. The most common form of hair loss in men is called androgenetic alopecia.
In men and women. That's the most common form in men and women. Keep that in mind.
And it typically follows the Norwood scale.
Oh man, the Norwood scale, I sometimes will cite the Norwood scale, but it's a very limited way of really analyzing or observing hair loss in men. And, look, like here they have these like 7 different stages, right? But in reality, people present in all types of variants that don't exactly follow these stages. And I think that's something that we need to realize. In clinical medicine, people don't always come in looking exactly like this. And, so patients will ask me like, what Norwood scale am I? And I tell them, clinically, it doesn't matter so much. And they might look like a Norwood 2, for example, but they might have pretty diffuse thinning throughout. And we don't have a specific scale for that, right? And there's different like gradations of thinning. They might be at 30% of their original density or 50% of the original density, or maybe even 70% of original density, but to them, they feel that it's thinner in this DHT sensitive zone compared to the rest. So again, it's a limited scale, in my opinion, not the most useful clinically, a little bit more useful for research.
which maps 7 stages of hair loss.
If we simplify this further, there are 3 major levels of hair thinning that most men fall into. Let's call it TLT: thinning, loss, and damage. The first level is thinning. At this stage, hair loss is subtle, a bit of shedding, slight hairline changes. This is usually seen in people in their late teens to mid-20s, but it can happen earlier too. It's often triggered by stress, poor sleep, dandruff, or bad lifestyle habits like junk food, smoking, or irregular routines.
It could just happen with all these things being optimized if the genetics are there.
You'll notice more hair on the pillow, but your friends probably won't. This is your best chance to take action. This is the point where you can begin basic treatments like Minoxidil.
Remember, the truly preventative measure here is not on this list, which is finasteride. You know, a lot of times people are so worried about the side effects of finasteride, they just don't even try it. They don't give it a chance. But we know its safety profile over the last, many decades, and overall is considered very safe, but it does have potential risks. But the sad part, in my opinion, is that when people try all these other things and they're like, oh, I'm trying 10, 20 different things for preventing hair loss and for improving my hair, but nothing's working. But they're not on the main thing that actually works. And so that's kind of not ideal, in my opinion, because what I hear mostly in my practice is not about these terrifying, side effects. If we get a side effect, we treat it accordingly and we drop the dose and then people are fine. But what I hear much, much more frequently than dreaded side effects is that people wish they started on finasteride or dutasteride earlier so that they don't lose so much hair that then they need all these surgeries and, all these heroic efforts to restore things. But again, that hopefully is something they'll get into in this latest chapter, in this chapter 2.
You can add some kind of scalp care to your routine like anti-dandruff shampoos, gentle oiling on the body of your hair for moisturization purposes. And if you also work on lifestyle factors like diet, or if you quit smoking or reduce your alcohol consumption, you're usually on your way to recovery.
Well, that's false. I mean, most of the time people do all those things and then they're super frustrated when nothing got better in terms of their hair. So, just saying that just change these habits and you'll be fine is, I think, not accurate.
The second level, loss. The hairline's clearly receded, the crown's thinning, and the overall density feels lighter. Styling your hair becomes tricky. And if you find yourself checking your hairline constantly, this stage commonly affects men in their mid-20s to their early 30s, especially those with a family history of baldness. This is where consistency with treatment becomes everything. At this stage, many choose to opt for a proper hair care combo of Minoxidil and finasteride, obviously only when guided correctly by a qualified dermatologist.
And in the US, a lot of people have been getting their Minoxidil and finasteride prescriptions from feelconfident.com. So if you are interested in those, if you think that's something that could help you, you can get that through feelconfident.com.
Now, as per the Indian Dermatology Online Journal's research paper, Minoxidil stimulates hair growth and finasteride temporarily blocks DHT, dihydrotestosterone, a hormone that's believed to be one of the contributing causes to male pattern baldness. It's not too late, but you can stop the hair loss at this stage. These factors can slow things down or maybe even regrow what's left in some cases, but you need to be guided by a qualified dermat. Now, the third level, damage. This stage usually hits men in their 30s and beyond. The crown is mostly visible. The hairline's faded by this point.
Damage? Wow, that sounds severe. I mean, it's still hair loss. I don't know about damage.
And the middle area may have completely thinned out. By now, your shampoos, oils, and serums are just maintenance. They're not cures. So what's the real solution in this case?
Transplant.
A hair transplant. Now, if you've got the resources and you're looking for a permanent solution, a hair transplant might be worth considering.
Remember, some people decide to shave their head. That's an option. Some people do nothing about it. That's an option. Some people get hair systems or like a hair wig, right? So that's another option. It's not just hair transplant surgery, but I get where he's going with this. If you've, decided on medical therapy, but you're kind of late to the game and you've lost a, significant amount of hair, even if you start minoxidil finasteride, it still won't necessarily bring you to where you might want to be. And that's when you might consider surgery. So that's a good point there.
But here's the thing. You're going to have to invest your time, money, and some patience as well. We're talking about confidence growing back quite literally, strand by strand.
So he's Rishabh and it's day 1 of his procedure.
Let's see what they're cooking up today.
So I would like to explain how we design a hairline on any patient. That's the most aesthetic part about a transplant.
It's not just hairline design, like the actual technical steps of a hair transplant can be quite artistic too. And that relates to the way that the hair is harvested, both with FUT and FUE. And also when the actual incisions are being made, or in the case of implanter pens, the way that the grafts are being placed is also very much an artistic process. It's not just like the lines that are drawn for the markings at the start of the day. That's just the start of that. And I have a whole video on hairline design and, the artistic elements of it. So if you want to watch that video, go check it out.
So first thing is aesthetically, face is divided into 3 equal parts. That's from the chin to the tip of nose, from tip of nose to the glabella, the wet point, and from the this to the central part of the forehead. Okay. This is the main lowermost point on the forehead.
So that's the lowest that the hairline should be, but in most men, that point, especially from a transplant perspective, should be higher than what the measurements would suggest, right? Because again, there's a limited supply, and if you have a lot of space to cover, the higher you start, the more aesthetically safe it will be, because you can then generate some decent density higher up. But if you started too low, it's very difficult to then chase that back with a lot of hair density, even over the course of several surgeries. So I think that's something really worth pointing out here. And I really only use the horizontal thirds to guide people as far as how low we should go, because some patients will try to drive me even lower, and I'll say, but look, the horizontal thirds, we don't want to go lower than this. But again, oftentimes that hairline should really be placed higher. Also, as we get older, hairlines naturally get a bit higher and more recessed, and you don't necessarily want to be 60, 70 years old with a hairline right here. It just doesn't look right. So when we're in our 20s, we might want something that's very different than when we're much older. But you'll continue to age and, hopefully, live for many years. So you have to keep that in mind when you are younger and looking to get surgery. Because again, this is a more permanent solution. The hair that's being used for these surgeries is more resistant to DHT. So you might be left with like an island of hair that's low and then lose a lot more hair. So it's important to think of hairline design in a much more nuanced way than just looking at those horizontal thirds being equal.
This is the distant center part. This is the sideline. So this distance from the lateral eyebrow to this point will be equal on both the sides.
Remember that we all have some built-in asymmetries, and that's a normal, beautiful thing. And so it's impossible to get everything perfect from one side to the other because the shape of the bone is different. The actual bony architecture is going to be different. And our heads are not exactly the same from one side to the other. So to get the hair to be exactly the same is first of all just impossible. And second of all, can sometimes drive people nuts if they think that, it needs to be exactly the same. So some healthy asymmetry is actually a normal good thing.
Now the shape of this line would almost match with the angle of the jaw. Okay, that will match with the structure of the face.
And adding in temple hair can be a good thing in terms of reducing the horizontal width of the forehead and sometimes helping to frame the face, but it does chew up a lot of grafts. So if there's a lot of thinning elsewhere, we sometimes will avoid the temples as part of the restoration plan.
And the most important comes the crown part. Now if you notice over here, in the crown, every individual, it is a whirl pattern, like a whirlpool. Yes. So we have to make sure that we implant the follicles in these angles and directions in the circular pattern so that it matches with the natural density.
Remember, when it comes to density in a transplant, it's very difficult to achieve the original density that the person once had. And I think if that's the expectation that a patient has, they might be disappointed, or they might just have to undergo, multiple procedures to get them to the density that they were sort of dreaming of, or to their original. But I think a healthier way to go into a transplant is to accept that the density won't necessarily match your original exactly. And, that's kind of how I like to coach my patients when they're preparing for surgery, rather than promise them, original density and then have them be more disappointed when it doesn't quite achieve that same original density.
How are you feeling, Mike?
Yeah, just kind of nervous because how the procedure goes, and I'm really nervous about whether will I get my hair back. That's just normal.
That's a normal anxiety, but I can promise you can imagine yourself what you were 7-8 years back, and that is what you'll be seeing yourself in 26.
No, you'll kill it.
I work in a kitchen, so it was mostly because I used to wear my cap a lot.
See, even in that design, you can see that the right side has a little bit more recession than the left. And again, that's normal. The right side of his head is a little bit wider, and that bone is a bit more curved on the right compared to the left. And even his temple is more receded and pushed back on the right-hand side compared to his left. And that is something that's normal, and we see that all the time in our patients. I kind of like that higher line for him as far as where the hairline is being planned, and it looks like they've kind of pushed it down, fairly low there. But again, every patient has his or her own goals, and I think from a surgeon's perspective, I try to kind of suggest what an optimal position would be for a hairline and how to properly draw it, and then there's room for negotiation there. At the end of the day, we have to, kind of have happy patients. That's the goal. And some people come in with a very specific aesthetic that we try to create for them if it's reasonable. I mean, there is a range of reasonable, and if it falls outside of that, then I just tell them, look, I don't think that, I'm the right fit for you. So my aesthetic needs to line up to some degree with what the patient wants, but people need to realize that we're here for our patients. And if they have something a little bit more specific that they've been thinking about, we definitely try whenever we can to accommodate that.
So I felt like that was probably one of those reasons where I started losing hair, my hair thinning started from there. But also other thing was I feel was smoking, when I feel that maybe it impacted somewhere.
It's unlikely that smoking played a big role in his form of hair loss, since he has a very standard male pattern form of loss. But as far as smoking and surgery goes, you definitely want to avoid smoking for at least 3 to 4 weeks before and after surgery, because that nicotine content can actually reduce blood flow to the transplanted area, and that could impact on overall healing and graft survival potentially.
We'll be concentrating on the areas. We divide the donor area into 3 parts for day 1, day 2, day 3, and accordingly.
So they're doing 3 days of surgery. Interesting. Yeah, I try to shoot for like 1 long day for my patients and then give them time to heal, and they can come back in 9 months to 12 months for something additional. But I know some doctors will divide it into multiple days. I think it's just a lot on the body. And yeah, I mean, I don't know. That's not my preference, but definitely something that some clinics will do.
We'll be giving local anesthesia over here.
Just to make it clear, I mean, it's a overall pretty safe approach to divide it over a few days, but I think it's just a surgeon and clinic preference type of situation. And I think patients too, some are prepared for multi-day surgery and some are not. So again, it's good to discuss that, pros and cons, with your doctor.
Along with the tumescent fluid. So basically, it's a combination, it's a mixture of a fluid where we use 90 ml of normal saline with 8 ml of lignocaine, that's a local anesthetic, short acting, and 4 ml of bupivacaine, which is long acting. It's a combination along with 0.5 adrenaline.
Yeah, I also like to use Marcaine as well. It's good for long acting anesthesia, as this doctor already said. So we also have lidocaine and Marcaine in a mix in our formulas.
So that anesthetizes, plus we make the skin prominent, which will help us to extract the follicles from the roots.
Yeah, so they're clearly using FUE technique. So that's the 1-by-1 harvesting, and not sure exactly which system they're using, but this is a motorized handheld system. We use the WA by Dr. DeVroy at the moment. And, similar kind of concept. You have this little cylindrical punch, and it's going in, and the first step is that it kind of cuts through the skin, and then it goes down towards the actual root of the follicle. And that's kind of how it releases it. And then you need to use forceps to then pull that graft out of the scalp. So that process is the punching, and it's done in a careful way to avoid over harvesting any one area. So you distribute the harvest over a wide area, and by doing so, you're definitely thinning out that hair, but in a way that makes it a little less obvious, especially when the length of hair is sufficient in the back. If you have a really short style, you will see small dot scars, at least the way that FUE is currently being done. But even then, it becomes fairly difficult to see those scars in most people. For some people, those little white dots are more obvious. For other people, they're not too obvious, even with a very short hairstyle in the back.
I've just extracted around 400 follicles. We'll extract more later.
400 follicles?
Yeah. How do you count? So that is, they'll be counting now. We'll be doing around 1,000 to 1,200.
But you see, this is what I'm talking about. They're referencing one of the earlier points in the video where they said, oh, the doctor is doing everything. You can see that he's currently not operating. From what I can tell, he's talking. So there are team members who are counting the grafts, sorting the grafts. So that's all manipulation of grafts. So you need to trust whoever you're working with in order for the process to go as well as it can. But this is not a one-man show. And it shouldn't be a one-man show. This is a team effort. These surgeries take all day and are very labor intensive.
We're taking a bit of a 10-minute breather right now. It's a medical procedure, so for the doctors it's very normal. But obviously if you're there as a non-medico seeing it, it takes some time to wrap our heads around.
When you listen this in a podcast, it looks like normal, hair transplant ho jata hai, but when you actually saw this is...
Takes some time.
Yeah, it's real surgery. So that's why when people try to sort of downgrade hair transplants to just being some, minor procedure, it's not. It's a long day of surgery. And even if it's done awake, it is real surgery with real risk. And we have a video on risks and complications of hair transplants that, if you're interested in that, make sure to check it out. Or if you're interested in a hair transplant, you really should watch that video because you need to know what you're getting yourself into. This is not, just a little haircut walk in the park, right? So yeah, I think people need to appreciate it as a true surgical procedure. And with that comes the importance of good, safe care. And, again, being able to find a clinic that you feel like you can trust.
See, the truth is, it is an invasive procedure, but it is painless. Like, I've had some painful tattoos inked on myself, and he said that it was only 60% of that pain, which probably is nothing.
Well, it's not completely painless. I mean, you still have to get numbed, and so that can hurt. And people metabolize the actual anesthetic to varying degrees. So some people require more, but at some point you can reach toxic levels of the anesthetic. So how do you manage that, right? Sometimes, for example, the central hairline in a small percentage of patients can be very difficult to numb. So in those patients, we'll actually do a V1 block, which is blocking one of the regional nerves to the area. If you don't do that, you can end up injecting a ton of lidocaine and potentially reaching toxic levels. So this is no joke. And some people, it's very difficult to numb them both in the front and the back. So it's not painless.
Like a tattoo from a good tattoo artist just feel like someone's taking a pen and drawing on your skin.
I think it depends on the part of the body. I mean, I don't have any tattoos, but from what I hear, certain parts of the body are a bit more sensitive, right? And you'll feel the tattoo more. So that I think can hurt as well.
So yeah. Glad to be bringing this content for you guys. So I'm not able to talk right now.
It's important to keep these grafts in some liquid, right? You don't want them drying out. That's actually one of the main reasons why some hair transplants don't work, because the grafts are actually drying. So we keep them in some form of fluid. We prefer in my clinic at the moment Plasmolite and ATP, but there are plenty of surgeons who just use a normal saline solution. So, there's varying thoughts and beliefs on that. But the most important thing is to not let the grafts dry out.
That's what a whole hair follicle looks like.
Yeah, so we've recorded a single unit, double unit, triple unit, what I was mentioning, how we'll be spreading it single unit in the first line, then transition zone, then second and the triple.
To make it highly simplified, this is like tree replanting, right? Like you're pulling out trees from one location and placing it in another location.
Yes. Normally we have something on the screen.
Like you'll be able to speak.
I have patients who do their office work. I have some patients who play video games, some watch matches.
Yeah, we have a TV for patients as well, but a lot of times they're cool just like hanging out and having good conversation with my team. So everyone's different on, what it is that they're, looking to do during the surgery. There are times when it's best to just kind of be quiet and, rest and relax, and we have to move the head a lot for the incision making, for example. But certain parts, you're able to listen to music, you can, just watch some good movie on TV. So yeah, it's not a bad day, but it is a long day. And here it looks like they're loading some form of like an implanter. It looks like it's actually like just a needle, but they might be using that as some form of an implanter pen. We'll see how they're actually placing the grafts. Yeah, so they're taking the graft, they're putting it into a hollow bore needle, and they're then using a forceps to guide it in, right? So that's one way to do it. There's also placement methods, like the way that my team does it is just forceps. You need a lot of experience for that method, but it's something that works really well, has a high level of versatility, but definitely a steep learning curve. And then you have implanter pens, which you fit the graft into an actual like little pen, and then you can use a plunger to place it in. And some of those pens are dull and some of them are sharp. So in this situation, he's using it, from what I can tell, as like a sharp implanter, but they're just using needles as an alternative to a sharp implanter pen.
We've only spoken to guys today, and I think it's so important to have a girl also speaking about this problem, because there might be a lot of girls who are silently suffering.
They are. A lot of them. When around you, there are girls who have better hair. So, you're demotivated in that way because they are not giving us motivation. They don't understand what we've been through.
I'm glad they're bringing up women's hair loss issues as well here, because I was a bit worried they weren't going to touch on it at all earlier in the video, but here they are. So that's really good, because it definitely affects a ton of women. And arguably, they're more affected emotionally by hair loss than men are, right? I mean, again, you can make different arguments, but yeah, it definitely is a problem for women as well.
So we used to feel angered.
A little. But then, I thought that yes, this shall too pass, and then a day will come where I'll be very confident and it will work out for me.
Before going for the transplant, did you try other things?
A lot of things. I've tried different things, at-home remedies, crushing onions and fenugreek together, making a paste and just...
I had male pattern baldness, like my father. It is genetic as well. And then I have PCOS also, so it was one of the other factors. I tried everything, medicines and other, maybe whatever treatment is there for hair. And then it didn't work out.
What made you finally go for a hair transplant?
See, everything else is a scam. Yeah, because this is the only thing that works.
That's not true. It's not all a scam. It's just that, there's lots of things out there, and, they covered a lot of it in the video, some of the main medications that are effective. But if you just think of everything else as a scam and surgery is the only thing that works, then you might end up somewhat disappointed if you rely solely on surgery for hair restoration results. Because again, we're working with limited supplies in the donor area, and that's just like the truth, right? So it's not always possible. It's rarely possible, honestly, to restore density in the DHT sensitive zone to like the original density of one's hair relying on surgery alone. And it's just the truth of the matter. So we very much look to medical therapy to help our surgeries thrive and for the hair to look as good as it can look for as long as possible.
What's your message to younger guys who are going through this?
I think no one should be scared of this. This is like almost like going to a spa or a normal haircut.
Okay, it's not that. I think they were mentioning that earlier with the risks of surgery and that, it's real surgery. So it's not like going to get a haircut. So again, I don't like the approach of, downplaying the risks of a real surgery. So let's not do that.
I just say, bro, be a rock, build yourself up, make the money, go get the transplant done.
I would just say, just have a lot of self-confidence. Don't lose hope, which I did.
You keep quiet, you keep taking it, they're gonna think it's fine and they're just gonna keep doing it. But the minute I spoke up and I told them this is not okay, it made a huge difference. I really hope someone sees this and be like, you know what, it pushes them to go get it done, because Trust me, it makes a huge difference.
Yeah, when it's done properly, it can make a huge difference, for sure. I mean, I see all these types of responses, in my clinic, and it is really nice to hear all that, because that is, for most people, there's, kind of a take on their transplant experience. But again, that's when things are properly done, when you really listen to people for what they want and what they're hoping for, and you're not just trying to please everyone on the internet, but you have to treat your patients well. And usually that's the type of reaction that we see as well.
If you're in a position where you cannot afford a hair transplant just yet, hold your horses and remember some of the most confident men that we've seen as we've grown up in our lifetimes. Vin Diesel, Jason Statham, The Rock, Michael Jordan, Pep Guardiola, Jeff Bezos. All of these people have dealt with receding hairlines. At the end of the day, you've got to really go within yourself and understand that in the lowest phases of mental health, there's also a tiny opportunity for you to work on your mindset. So if it's a very big problem for you and you can afford it, go for a hair transplant. If you're not sure you want to go for a hair transplant, go to a qualified dermat and get some guidance. And if you're not in a position to pay for a hair transplant or to pay the fees for a qualified dermat, my suggestion to you is hold your horses, grab as much education as you can, but do not let your mental health slip away, brother.
Yeah, I think expecting a hair transplant to completely change your mental state and to make life much better for you again is not the most practical way to approach it. I think trying to improve your life in every way possible all the time, whether with hair, without hair, is a much better way to go. And I think ultimately a much better investment of time and energy and potentially money than just surgery. But if you have all those things and you have some hair loss and you're looking to improve that situation, then of course there's medical therapy, there's surgery that can help. So I think that's really the best way to approach all this. Thanks to BeerBiceps for putting together this wonderful documentary. Hopefully this additional feedback and insight for me was valuable to some people out there, and thanks for watching.